Morning. My administration's vision for Lincoln is to ensure a more successful, secure, and shared future for us all. And to achieve this vision, we continue to make investments in public safety that allow us to address the needs of our community holistically. All residents should feel safe in our community. And the Lincoln Police Department is an incredibly important agency and part of the solution that ensures that everyone who calls Lincoln home feels safe, secure, and seen. As are our partners in Lancaster County government, who share our commitment to keeping our residents safe. Today, city and county officials are here to update the community on vital strategies we are pursuing to provide even more thoughtful and effective emergency services to some of our most vulnerable community members. And specifically, we want to share how we are addressing one of the growing challenges for our law enforcement and justice community: responding to the needs of residents in crisis, particularly those experiencing mental health issues. And to give you a sense of that growing challenge, over the past decade, our community has seen an increasing number of mental health calls for service. The COVID-19 pandemic has exacerbated that increase. So far in 2021, we've seen a 20% increase in mental health calls for service compared to the same time period the previous 4 years. These statistics are not so surprising when you consider not only the global pandemic that we're enduring, but also the fact that every year, 25% of us are affected by a severe mental illness, such as major depression, bipolar disorder, schizophrenia, obsessive-compulsive disorder, a severe anxiety disorder, borderline personality disorder, or a post-traumatic stress disorder. Society often wrongly imposes a stigma on people because of misunderstandings about mental illness. But here in Lincoln and Lancaster County, we know that severe mental illnesses like these are highly treatable medical conditions. And our public safety professionals understand and demonstrate day in and day out an attitude of respect and concern for people experiencing mental illnesses. In a few minutes, the chair of the Lancaster County Board and the county attorney will highlight new federal funding obtained by our county to strengthen crisis response services for juveniles in our community. Before they do, I want to brief you on how the city budget adopted last summer provides additional public safety resources to respond to the increase in mental health calls and the growing need to support both vulnerable residents and the officers who serve them. Our budget invests $150,000 to support additional services and training to enhance the response for residents experiencing a mental health crisis. And when we announced this investment last year, we did so with the support, unanimous support, of the Lincoln City Council. And we're grateful to all of our council members for that shared commitment to this effort. And following the council's approval of the budget, we engaged a group of community stakeholders to determine the best use of those dollars to respond to residents in need, alleviate the workload for officers where possible, and to set the stage for exploring alternative responses in the future. So in pursuit of these objectives, we are deploying our budgeted program dollars in 3 key areas. We will strengthen existing partnerships to serve residents with mental health issues. We will make new investments in mental health training for our law enforcement professionals. And we will explore non-law enforcement alternatives for responding to mental health crisis incidents. Now, these investments build on the Lincoln Police Department's strong history of partnering with local organizations to connect residents to resources such as mental health services and domestic violence support. Our officers are deeply committed to providing protection and safety for all of our community members and to keeping people out of the criminal justice system. LPD's partnership with the Mental Health Association of Nebraska through the REAL program has provided support to officers responding to calls regarding community members with mental health needs since 2011. The REAL program, which stands for Respond, Empower, Advocate, and Listen, connects peer advocates who have experienced mental illness to people who have non-criminal interactions with police officers. And since its inception, this program has seen 4,200 referrals made by over 300 officers. And this successful partnership has improved our outreach, community support, and quality of life for members of our community facing difficulty with mental health concerns. To support the continued success of the REAL program, the City of Lincoln will dedicate $40,000 to fund an additional peer outreach worker. And this position will enhance the program's capacity and provide more intensive ongoing supports for individuals in need. Additionally, in the new upcoming fiscal year, the city will absorb the programmatic costs previously funded by the Community Health Endowment and will incorporate support for the REAL program into the future on a permanent basis. The city also will provide funding to support the work of a dedicated coordinator to assist LPD as they collaborate with community service agencies to identify individuals in our community who have ongoing interactions with law enforcement related to mental health concerns. And at the same time that we recognize the value of these important collaborations with peer specialists and partner agencies, we also know that our law enforcement officers are routinely called upon to interact with members of our community who experience mental health challenges. And this is why it's critical that we provide our officers with the support they want and need to be effective in these interactions. Our dedicated officers desire knowledge and insight about the mental health resources available in our community and access to the most current education and training to make those interactions the most positive experiences that they can be. LPD has access to important training for law enforcement provided by Region 5 and local community agencies through the Behavioral Health Threat Assessment Program. And we will dedicate a portion of the funds budgeted to support additional number of officers to access this vital training with the dollars allocated in our budget. And finally, while bolstering the current excellent work and collaboration with local service agencies, we know we can learn from other communities that have implemented alternative supports for mental health crisis incidents. A national model of crisis response, the Crisis Assistance Helping Out on the Streets, or CAHOOTS program based in Eugene, Oregon, has demonstrated great success in this area. We've entered into a contract with the Whitebird Clinic, which manages the CAHOOTS program, to develop recommendations and a programmatic framework for a mobile crisis intervention service program. And as a part of that contract, the folks from Whitebird will hold meetings and planning sessions with our City of Lincoln staff and community stakeholders, including service providers, consumers, and community groups. They'll assess the existing crisis response framework in the City of Lincoln, identify equipment needs and associated sourcing and costs, and provide additional technical consulting support as needed. These additional investments build on our city's rich history of strong community partnerships established and nurtured by the Lincoln Police Department. Acting Chief Brian Jackson is here today as well, and he's going to provide some additional information about the department's work in the area of mental health crisis response. Over to you, Chief.
Good morning, and thank you, Mayor. And thank you, Mayor, for the vision you had last year for the budget to identify the additional needs available that could be made available to us to provide those resources. Thanks to the council for accepting that challenge. And we are pleased to be able to identify those opportunities to enhance what we already do. The Lincoln Police Department is identified nationally as a leader in mental health services and responses. We have a number of officers that partner with other agencies that travel the country providing training to other officers and other agencies to help their members provide better services to the communities they serve. We have a number of subject matter experts within the department. Those subject matter experts have developed problem-solving skills and developed the partnerships that have evolved over the decades that have created the opportunities that we have to serve the members of the Lincoln's community to provide services and programs when in crisis or when in need. We're very proud of that program. This last year, with the knowledge of the support of the mayor and council, we have identified a mental health coordinator that to better help coordinate the services that we provide and the partnerships that we have, and so that there isn't time lost, there isn't money wasted, that those valuable dollars and that they can be spent and those times can be spent providing the services and programs to the people who need them. And we're proud Officer Dolberg is here today to answer any questions you may have later. But we're proud to have Officer Dolberg here, selected from a strong group of candidates that vied for the same position, and we believe that will just make a stronger mental health program for the community into the future. The mayor outlined the vision for the added budgetary dollars. We're excited to be part of that. The training that are already given to our officers can be expanded for more frequency and to touch those people who haven't had that training yet. We have significant training in mental health resources and mental health needs and how to respond to people in mental health crisis. The Lincoln Police Department strives for continuous improvement, and whenever those opportunities exist, we seek to take advantage of those. And this is an excellent opportunity to find those opportunities, as well as identifying others who are problem solvers and have found solutions within their communities that the City of Lincoln may also be able to latch on, grab, and apply, again, to make livability of Lincoln better, not just for everyone, but for those individuals too that may struggle and have difficulties. I want to thank you and make sure that we thank our partners, MHA, Region 5, Lutheran Family Services, and I'm going to forget somebody, the Bridge, Bryan Hospital. There's just so many individuals that assist us in our efforts, and it's not the Lincoln Police Department, it is not any agency standing alone, it's all of us together that are able to work and provide these resources. And so we're very proud of this opportunity, and this is really gets us excited because it gives us an opportunity to keep people out of the mental health, out of the criminal justice system, and provide them the services that they may need, and that's really our goal. And so, thank you, and we look forward for these opportunities.
Thank you so much, Chief Jackson. And at this time, I'd like to invite up to speak the Lincoln City Council Chair, James Michael Bowers.
Good morning. My name is James Michael Bowers, and I'm currently chair of the Lincoln City Council. In addition to serving on the City Council, I'm a practicing therapist and social worker, and I've seen firsthand how difficult to navigate, how confusing, and how frustrating our mental health service system can be. As someone who works on the front lines, I am proud of our city for taking the first steps to ensuring and helping fund and to provide services and supports to individuals who are experiencing mental health issues and those that work with them. By directing more funding, more training, and more concrete steps to move forward, we're going to lead our city to become safer, healthier, and one where everyone can reach their potential. Thank you so much.
Thank you, Councilman, and thank you again to all the members of the Lincoln City Council. So the city and county partner to serve the residents of our community, and I'm pleased to introduce next the Lancaster County Board Chair, Commissioner Rick Vest. He's here to discuss 2 federal grants obtained by the county this year that will provide additional services to juveniles. Commissioner Vest.
Thank you, Mayor. Good morning. Thank you, everyone, for being here. Thank you, Mayor Larry and Gaylord Baird, for including us on this important announcement. I am Rick Vest, the chair of the Lancaster County Board of Commissioners. There are 5 members, and I'm honored to represent them here this morning. A brief story that I think illustrates what we're trying to accomplish with this initiative. I grew up in a small town called Greenwood, Nebraska. Wonderful place to live. One of the great benefits we had there was a scoutmaster of great integrity and wisdom, and he taught us lifelong values. And one of those was always leave a place in better condition than you found it. And I'm honored to be on a board of commissioners that abides by that and works diligently towards that goal in the decisions we make. And we're very fortunate that we have such a strong partnership with the City of Lincoln and the Mayor's office that we can institute programs like this and know that we have the resources and support to make a difference in people's lives. I'm going to read about the 2 grants that we've received, and it's through the diligent work. We have some great staff people, and they work diligently to find these grants. Let me just continue with this. The Lancaster County Board of Commissioners knows that our youth are the future of our community. In order for our community to thrive, we need to assure that our youth are taken care of. And this includes ensuring that their basic needs, their educational needs, and their behavioral health needs are met. To this end, I am excited to share with you 2 federal grants totaling over $1 million to better support our children. The first grant provides for an expansion of our existing youth crisis response system. This will allow for more evidence-based community services. We're fortunate to have high-quality and well-trained community partners, which are key to achieving this goal. Providing these services already, but this funding will enhance and help us build an even more robust service delivery system so that when our youth and our family and their families are in crisis situations, they can get the services they need at the time when they need these services most. The second grant is for the development and implementation of a youth mental health diversion program. This program will build on our existing diversion programs, but will allow specialized services for youth that have identified behavioral health needs. This program is going to be administered through the county attorney's office. Pat Condon, the Lancaster County attorney, is here, and Pat will come forward and share more information on this program.
Again, good morning, everyone. Thank you, Commissioner Vest. Thank you, Mayor, for inviting us here today. My name is Patrick Condon. I am the Lancaster County Attorney. And as the Lancaster County Attorney, my office has continued to build on our already nationally recognized array of juvenile diversion programs. Through these programs, we are able to divert hundreds of juveniles in our community from the formal juvenile justice system each year. This is a result of the discretion my prosecutors use in conjunction with the life-changing services provided by our system and our community-based partners. Thanks to the grant discussed here today, mentioned by Commissioner Vest, we are able to expand our juvenile diversion program to the youth who have identified behavioral health needs. This will allow us to hold these youths accountable while ensuring they receive the treatment they need, whether for mental health or substance abuse disorder, all without the unnecessary entry into the juvenile court. A typical case plan for a youth in the mental health diversion program will be obtaining services from a dedicated therapist and family peer support provider, both devoted to the youth in this program. The case plan may also include reparation to the victim through a restorative justice approach. The core of this program is to ensure that youths receive the treatment services they need at the earliest point possible without having them processed through the formal system. I believe that our new juvenile mental health diversion program will help advance public safety as well as improve the long-term outcome for the youths with mental health or substance abuse disorder. Finally, I want to acknowledge the appreciation I have for the collaborative work being done between my office, the Lincoln Lancaster County Human Services, the Lincoln Police Department, Nebraska Department of Health and Human Services, the Lancaster County Public Defender, and Centerpoint with this exciting new program. Thank you. Mayor?
Well, thank you so much, Mr. Condon, and to everyone at Lancaster County. And thank you to all the social service organizations and community stakeholders and law enforcement and justice professionals for their hard work on this effort. Our unity in a holistic approach to public safety is essential to our effectiveness in addressing these evolving and growing needs in our community. And at this time, we would be happy, any of us, to answer any questions from the media. Any questions?
I have a couple. This is Margaret from the Journal-Star.
Margaret.
Hi. So the coordinator, let's see, you have another outreach worker, right?
Right.
For the city, there's another outreach worker for the REAL program.
Right. We're funding another peer mental health worker.
And how many do you have right now?
That's a good question. Can we? We have two full-time and one program coordinator currently.
Okay, so this will be, so then now there'll be 3 outreach workers who will work. Okay. And then I also wondered but how many LPD officers have received this mental health training, and how much more will this will the money or whatever programs you're doing, how much will that be expanded?
I'll ask Chief Jackson to talk about how many people in the department have already had this kind of training, but this new enhanced amount of funding to support training should support an additional 25 officers, or 20 slots for 25 LPD officers going forward.
Okay, thanks.
The behavioral health threat assessment training has been offered annually for quite some time. We have a majority of our officers that have attended that training. It has been voluntary. Many in our recruit classes are always giving some type of mental health training. These added dollars provide extra opportunity to provide what had been limited resources or limited opportunities, expands those, as well as expands the amount and quality, type, extent of the training that's provided. Majority of our officers is the quick answer.
So this money then will provide additional training to officers who've already gotten it, or?
Right now, it's offered, and I didn't mean to interrupt you, my apologies.
No, that's okay, go ahead.
Right now, it's been offered annually, once a year. This will provide an opportunity to provide it twice a year, so it doubles the number of seats. It also provides an opportunity to enhance that training, so those that may have received the training years ago can reattend and find, this all evolves, and it provides an opportunity to get updated information on what's new in mental health practices, services, and programming, and so it all provides benefit to our staff.
Thank you.
Any other questions? Okay. Well, again, thank you to everyone who works day in and day out to serve some of our most vulnerable community members. We are very committed to this holistic approach to public safety and grateful for our continued successful collaborations. Thank you.